What is the biggest misunderstanding about Medicare for seniors? Danielle Roberts knows. In the last part of our interview, she also explains the most important fact about Medicare that would help seniors if they only knew about it. I mentioned earlier how I was surprised to hear that you're still stuck with 20% of your hospital bills, let's say, under traditional Medicare. Is that like the biggest misunderstanding people under 65 have about the program, or are there other misunderstandings that you'd like to set straight?
Well, with the hospital coverage, your primary, it's not that it only covers 80%. So with Part A hospital coverage, your exposure is if you spend even one night in the hospital, it's a $1,632 deductible. If you're in the hospital more than 60 days, you start paying a daily copay. I think it's $401 a day. And then that doubles to it might be 404, but anyway, it doubles to around 800. And on day 150, your hospital benefits run out completely. So on the Part A side, it's not that it's only covering 80%. It's that you have these deductibles and very expensive copays if you end up having a long stay. It's only in the Part B side where you would have that 20% exposure, but you have to keep in mind there are some really expensive things that happen on an outpatient basis: outpatient surgery, dialysis, chemotherapy, oxygen. If you had a lifetime of oxygen and you had to pay 20% of that cost, that is a really important reason to get a Medigap plan or enroll in Medicare Advantage. And Medicare Advantage plans cover the same services as Medicare Part A and B. It's just that your copays are going to work differently on the two different plans.
So it seems you know so much about these programs. Is there one thing that the most important thing about Medicare that would help seniors if they only knew about it?
My best piece of advice would be make sure that you start learning about this in your early 60s, because your income in the years when you are 63 and 64 may affect your Medicare Part B premiums when you are 65 and 66. So most people in 2024, they pay $174.70 a month for Part B. And then you're adding on the cost of a supplement or an Advantage plan. But you might be in a high income bracket where instead of 174.70, you might have to pay 500 something dollars based on your income. And so one of the important things that I think is don't wait until 3 days before you turn 65 to learn this stuff, because we see people that will quit their jobs early and take a big severance, or they sell a piece of property that's expensive and it has quite a nice capital gain on it. And then they get this letter when they turn 65 that says, oh, we see that you made a chunk of money when you were 63. And so your premiums this year are going to be much higher than the average. And you don't want to get caught flat-footed on that. So we do a lot of webinars for our partnership that we have with John Hancock. We educate their financial advisors on how things work. And we always say, like, the people attending those webinars, you're so lucky that you already have this financial advisor, because that advisor can kind of walk you through the minefield of what things we want to plan to either do when we're 62, when it's not going to affect your Medicare Part B premiums when you're 65, or things that you would do some tax planning around to try to reduce those potential extra money that you would pay for Parts B and D if you happen to be in those higher income brackets.
And since not everyone watching this works for John Hancock, tell me how Boomer Benefits could help seniors and our viewers.
Sure. So we are an independent, unbiased agency that helps you navigate your entry into Medicare. And something else that I would tell you to watch out for is that it's so confusing to get your original Medicare and everything all set up. And it would be lovely if I could tell you that you could just set it, forget it, and not worry about it after that. But that's not the way it works. There are all sorts of hiccups and issues that can happen with whichever type of coverage that you hook up. For example, we see this one all the time. The lab facility uses the wrong diagnostic code, so Medicare and your Medigap plan both reject the bill and tell you to pay it. Well, if you didn't have an agent to call, or you didn't know what to do about this, you would be lost. You would say to yourself, do I call the lab company? Do I call 1-800-Medicare? Or do I call my doctor? Like, I don't even know how to fix this. Do I even owe this bill? We see this happen all the time. So if you are working with Boomer Benefits, we have a client service team and you call us first. If you get a bill in the mail that you weren't expecting, don't pay it. Call us first. My team has saved our policyholders over $2 million in bills received that they didn't actually owe that we have fixed for them just in the last 2 years. So that's the kind of service that you can expect. It's going to help you with all of those things on the back end. And so what we are not helping you invest your money. We're not financial advisors. We are basically agents and counselors for you on whichever Medigap policy is the right one. And you're going to set that up for yourself working with us after we've educated you on how the plans work and we've looked at your zip code and we've run quotes and we can quote all of the major carriers. You know, the carriers in the insurance field for Medigap are ones that you're probably familiar with. We have United Healthcare and Blue Cross Blue Shield, Anthem, Aetna, Humana, Cigna. There's a dozen others that I could list, but all those carriers out there, they offer Medicare supplement insurance. A lot of them offer Medicare Advantage insurance. So you want to work with an agent that's independent and represents all of those so that we can quote you the vast majority of the major plans. And then you can choose which one has the most competitive premiums, or if you're looking at a couple of Advantage plans, you might find one where you like the specific gym benefit or the dental benefit. And you can get all those numbers in a one-stop shop when you work with an independent agent like us, instead of you having to call all those different insurance companies and get all the different quotes and talk to 13 different people to understand how your coverage would work. You're dealing with just the one entity at Boomer Benefits, and we also provide that back-end support. And our service is free because we get paid by the insurance company that ultimately you choose. So when you finally call in and say, all right, I'm going to sign up for Mutual of Omaha Plan G or whichever company you've chosen, then that's the extent of what you have to do in that instance. And we take the rest away. We help you do the online application. We help you get everything submitted. We let you know what your rates are going to be. And from year to year, if rates change on your Medigap plan or your Part D drug plan, you would just be calling us and we can continue to shop around for you for as long as you're able to switch plans due to health.
Great. You've been very helpful and appreciate it. And keep up the good work. Thanks,
Thank you.
Danielle.
My pleasure.